In Your Health this morning, People magazine and others grace their covers with glory stories about the benefits of bariatric surgery. We're talking about Carney Wilson, Randy Jackson, Al Roker have all touted their weight loss through this surgery. However, as we all know from our interview with Mad Coyote Joe, this surgery definitely has a dark side. And here to talk with us about this more extensively is Dr. Andrew Carroll, a familiar face here at Sonoran Living Live. Good morning.
Hi, how are you doing?
I'm very well this morning. I know this can be a very controversial topic because we have people out there who have definitely had some success with this surgery.
Right, surgery is surgery. Right. I mean, no matter what you do, it has its risks and complications. And what you're looking for is people whose current health problems outweigh the risks of the surgery. So you don't want to just be overweight, and the overweight we're looking for is a BMI of 40 or greater. You also should have comorbidities, diabetes, high blood pressure, cholesterol, things that you really shouldn't be living with for too long.
I don't want to talk over people's heads. Bariatric surgery, in a nutshell, can you explain exactly what this is?
Right. There are two major ones that are being done nowadays. There's the Roux-en-Y surgery, which is essentially an adaptation from a cancer surgery we used to do, where they make the stomach much smaller and then they re-divert the intestines. There's the lap band surgery, which is where they fit a small band around the stomach to just shrink the stomach size. And it's an adjustable thing. They can make that constriction bigger or smaller. And then there's finally the duodenal switch, which is a much more large surgery. The graphic right now is the Roux-en-Y surgery. Is much more simplistic, whereas the second one is the lap band surgery. You can see the band around the stomach, and that goes to a port which they can infuse with fluid to make that band tighter. And then the third one is the one that Mad Coyote Joe had, which is the this duodenal switch. As you can see, a much more complicated surgery. Increases the malabsorption so that people don't absorb as much nutrients. It's an accepted surgery, but again, it's much more complicated.
Absolutely. And with it being more complicated, does that mean more complications can be associated?
Well, the surgeries by themselves have high mortality, in my opinion. 1 in 200 people will die from this type of surgery.
Wow.
And I mean, that's a pretty large number to me. And then 1 in 8 actually have a serious complication, and that's 13%.
Okay, and these are extreme numbers here.
Yeah, those are pretty high. I mean, the risk of all surgery can have bleeding, infection, poor wound healing. Those are across the board. But then you have the specific risks with bariatric surgery, such as ulcerations where you sew the intestines together. Also, you can have what are called stenoses, which is where when you scar, the intestines start to constrict down where no food can pass by it. And those are pretty major risks from the surgery. Then you can have multiple herniations and whatnot. So, I mean, again, it's for the right people. And you want your surgeon to be asking the right questions. Not only if you're overweight, but what about being overweight is really a problem.
That's a question we should be asking ourselves. Are there any other questions we need to be asking ourselves?
You know, you should be doing the diet and exercise thing, and you should be very aggressive about it. And if you can't be aggressive about it, hire someone to help you, because it's much cheaper to hire somebody to help you, like a trainer or a nutritionist, rather than just jumping into the bariatric surgery, because you'll save yourself the money and you'll also save yourself the complications.
And quite possibly your life. In the case of what Mad Coyote Joe is saying, right now he's spent up to $700,000 in surgeries.
Right, yeah, I mean, he had a very, very complicated course, but he is not unique. That's what we want to emphasize.
Dr. Carroll, thank you for being here.
Thanks.
Appreciate it. And by the way, you can get in touch with Dr. Andrew Carroll at the Renaissance Family Care Center, I should say Family Medical Care Center. That number 480-282-8336.